So individuals who are experiencing impingement in the shoulder typically will have pain while abduction, and they will have pain while raising their hand up and grasping objects. This is how typically impingement presents with. So this is something present in all age groups, but specifically in people who are working on a computer and have poor posture. Then the next group of individuals are those who very regularly go to the gym. So you have two types of individuals. One is lean bodied individuals and those guys who put up a lot of muscle mass. So these guys who put up a lot of muscle mass, obviously because of muscle hypertrophy, they are not able to have the complete movement of the shoulder due to the hypertrophy of muscles, and they also can tend to have pain at the extremes of movement. So it's very important that you set your goals when you're going to the gym. What are you going there for? Are you going there for fitness? Are you going there to build muscle, or are you taking part in a competition? So work accordingly. The other group of individuals, as I said, was lean bodied individuals. Now if these guys do a lot of bench press or shoulder press, they tend to get pain on top of the shoulder. So on top of the shoulder there is this joint called the acromioclavicular joint. It allows for load transmission across the shoulder. So it's a very small joint, and repetitive overload on this can cause sprain, and if neglected it can lead to arthritis of this joint. So people who are very regular gym goers tend to also suffer from this problem called AC joint sprain or AC joint arthropathy. Then coming to one more group of individuals, which is overhead athletes, those guys who throw, so like fast ballers or stuff like that, baseball pitchers. So essentially what happens in this movement is, so your biceps has two origins. One is inside the shoulder and one is outside the shoulder. The part of the biceps that is inside the shoulder essentially originates from the glenoid on an area known as a labrum. So in the superior labrum, where the biceps is attached, these repetitive cocking movements can lead to pullback injury or a peel back injury. So due to which the superior labrum and the biceps gets detached from there. These individuals tend to have pain while doing the cocking up motion. They have a loss of strength in the shoulder. That's how they typically present. So this is known as a slap tear. As the disease progresses, the slap tear can become bigger. The labrum tear can start involving the back part of the labrum or the posterior labrum. Joint fluid can get accumulated there, leading to a condition known as paralabral cyst. So this paralabral cyst can also compress on the nerves at the back of your shoulder and cause weakness and pain in the shoulder. So these were the common conditions causing shoulder pain in younger individuals. Now if we look at individuals above the age of 50, so individuals above the age of 50 tend to have different problems compared to younger active individuals. One of them is common, which is known as impingement, but in elderly individuals, this impingement can be due to a different reason. So as we discussed before, the acromion is on the top of the shoulder, and some individuals may have a bone spur which can impinge onto the rotator cuff tendons. So this impingement can lead to shoulder pain in these individuals. So that is one of the causes for shoulder pain. Then as the impingement progresses, it can lead to tears of the rotator cuff. These tears are not traumatic but are degenerative. So the typical history is the individual will be having shoulder pain for 5 to 6 months, and gradually they start having weakness in the shoulder. That's how the rotator cuff tear progresses. This tear, as I said, is degenerative. You don't need a significant trauma for it. So a lot of times people tend to have pain from before, they fall down and then they totally lose the movement of the shoulder. That's very typical when people have a pre-existing rotator cuff disease. They fall down and injured some other part of the rotator cuff muscle, and then the shoulder decompensates, so they are completely not able to lift the shoulder. A lot of times these individuals who have these big rotator cuff tears also present with symptoms of dislocation of the shoulder during overhead activities. So that's a very important point to consider. When we talk about age group above the 50, obviously the arthritis is an important consideration. All your joints in the body are lined by hyaline cartilage. With age there is a wear and tear of the joint. So individuals who develop wear and tear of the joint or arthritis will present with constant pain loss of extremes of movement, and difficulty in moving the shoulder. Arthritis is a very important cause of shoulder pain, especially above the age of 65. So these are few of the important things which are non-traumatic, which can cause shoulder pain in individuals. So regarding the treatment of these problems, it's a very long discussion and we'll have separate videos for that. So if you liked our content, do share and like and subscribe to our channel. Cheers, have a great day.